You're listening to Sports Medicine Weekly with Dr. Brian Cole and Steve Cashel on 670 The Score.
And we're back on this Sunday morning. Steve Cashel, Dr. Brian Cole, Sports Medicine Weekly. Time now for our Ask the Doctor segment. It gives our listeners the opportunity to have Dr. Cole address their specific sports injury issues or those in the news that they're interested about. It's very easy to submit a question. Go to our website, sportsmedicineweekly.com. On the home page, you're going to find a link underneath the photo of Dr. Cole and yours truly on the right side of that home page. Click on that link, and you can submit your question. Dr. Cole got a couple good ones, and one is related to a Chicago Bears player injury. This listener says, Dr. Cole, last Sunday, Tarik Cohen, the Bears running back, suffered a torn ACL. My question to you is, even though I know you're not the doctor for Tarik Cohen, can he come back full speed, which he relies on in his profession, and get his ability to cut 100%? Or with a torn ACL, do you think he's going to lose a step in the cutting ability?
Steve, I would say that the answer is yes, he can come back 100%. And these are really fascinating discussions. You know, there's people, for example, who do, fantasy football and so forth, and they kind of want to know the disposition of an athlete who had an injury and is going to come back and what to expect. It's also the subject of a lot of research where we've looked at in the NFL, in the NBA, and MLS and soccer, where you can see how an athlete's statistics are prior to their injury, look at the recovery process, and then see how long it takes to actually accumulate the same numbers and stats that made supports their greatness. And I would tell you that it may not happen the first season, but it should happen by the second season. What's interesting is it's not all about the ligament. The ligament's strong, can support him, so when he has a step, it's going to stay so his knee doesn't give way. It's actually more about I've talked about this, a lot, is, what we call proprioception, which is how our brains interpret our joints to be in space and time, because timing is a really fascinating thing, and I think that's what leads to the athleticism of a lot of the athletes that we, have come to enjoy watching, that they just are phenoms because of the way their brains connect and could get them to do things that others can't do. So it's not just how strong they are or how much endurance they have or how smart they are at the game. There are some probable neurologic pathways that allow these guys to do what they do, and that also gets disrupted. Not only does the ligament tear, but that pathway gets disrupted temporarily. So the strength and conditioning and rehab is incredibly important to also focus on those issues. So if they can get all that stuff back, I would argue that statistically, I would bet on a player that a year later, as long as they have the right psyche, because there are times where guys are a little bit afraid and the fear factor interferes with their ability to do what they want to do. But I would argue that that's a bet worth taking, that he can get back without losing a step a year later.
Okay, I've got one final question from one of our listeners here, Dr. Cohen, our Ask the Doctor segment. Dr. Cohen, my 15-year-old daughter is a softball pitcher, just completed a 50-game season with COVID. That's pretty good. She threw a lot of innings. Can you give me a suggestion on how much time she should take off from throwing here in these fall and winter months?
So short answer is 2 months. Short answer is 2 months, and try to have some multi-sport involvement. And single sport involvement at this age is becoming obviously very common, but 2 months away from your sport in some meaningful way is the answer. And I think that our listeners, our parents who have youth athletes need to sort of adopt that, because that gives them ample time to recover, restore, and get back in the game again to reduce the chance of injury.
Great stuff. Okay, we're out of time, Dr. Cole. Terrific show. And we will talk with you again next Sunday. Stay healthy, you, your patients, your family, and yourself. And we'll look forward to another conversation, another show next week at 7 a.m.
Thank you, Steve, and have a wonderful week.
You too. Net proceeds from our show, Sports Medicine Weekly, go to support orthopedic research at Rush through the liveactivenow.org fund. A reminder, podcast segments always available to hear on the Sports Medicine Weekly blog, also through Apple, Google, Spotify, Pandora, YouTube, and iHeartRadio. Many thanks to our producer, Shane Reardon. Also want to thank David Cole for managing our website and our business operations, as well as Samantha Smith from Midwest Orthopedics at Rush. For Dr. Brian Cole, I'm Steve Cashel. We say so long. We thank you for listening to Sports Medicine Weekly. Be back next Sunday, 7 a.m. Central, with a brand new edition of Sports Medicine Weekly, only on
670 The Score.
Have a great rest of your Sunday, everybody. Stay healthy.
You've been listening to Sports Medicine Weekly with Dr. Brian Cole and Steve Cashel, only on Sports Radio 670 The Score and 670thescore.com, Chicago's sports station.